Hi Karen, what are the key messages for AHPs from the Francis report?
I think, first of all, there's one or two things that need to be said about the Francis report in relation to AHPs. Most of the time, us AHPs complain about not being visible in reports, strategies that come out, guidance, and of course this is one of those extremely high profile, if not the most high profile report for years. And in fact, I think most AHPs, including myself, were very relieved to find that we weren't mentioned at all. And I suppose there's a certain amount of relief that comes with that, but there's real caution from me about that. It doesn't mean to say that as a result of the lack of mention of AHPs that there isn't a problem, and that what went on at mid-staffs in some way didn't include AHPs. So one of the big challenges for me has been that it would be all too easy to see what was said by Francis about mid-staffs as being a nursing and a medical profession problem, and we could quite happily as AHPs be in a position where we think it has nothing to do with us. For me, there's three reasons why we can't go down that path. Firstly, there's a real moral imperative. What happened at mid-staffs, the descriptions that are in the transcripts, all of which I've read, that form the bulk of the Francis report, clearly indicate that it was a whole system failure. It wasn't something that could just be located with a couple of professions. And I think we have a moral imperative as clinicians to take full responsibility together for what happened to those patients and how those families had to cope. So there's a moral imperative. Secondly, I have great concerns if AHPs aren't part of the solution to how we move on from Francis, because there is a lot of money, there is a lot of attention going on how we move from a place where people are concerned that mid-staffs could happen again to ensuring that it never happens again, and AHP should be part of that solution. And the third reason that I think the Francis report throws up both challenges and opportunities, and this is perhaps where the opportunities come in for AHPs, is that there are a lot of good news stories about AHPs with regard to some of the issues that came up in the Francis report. We as a group of professionals have an exceptionally low complaint rate. In terms of our regulator, very few fitness to practice cases relative to the other professions. There is something that we do well in the allied health professions that actually, if only we were taking as a system a more appreciative inquiry approach, we could learn from what's positive rather than constantly trying to focus on the negative. So for me, the whole Francis report has thrown up a real dilemma and a real paradox. The first message that I would give specifically about the Francis report is to read it. If you can possibly read the transcripts, then I think you should. I think by reading the transcripts, you really get to understand the horror of what went on, and I think you do have to understand the horror before you can do anything about it. Then I think a key message for me is that it isn't just what we do for patients, but it's how we do it. And that links with the need to retain our basic humanity, to never ever forget that the people that we are treating, that we're working with, could be our loved ones, and we must treat them in the way we want those loved ones treated. I think another message is notice things. One of the things that really concerns me is that some of what was described on the wards at mid-staffs was very much an acceptance of that was the way things were done. And for me, that's particularly disturbing because AHPs tend to work in lots of different places. So they will have seen lots of different practices in lots of different wards. And perhaps would have noticed more the difference on those wards where there were problems. So another message is notice things and say something, good or bad. So I don't think enough of the time we say to each other as clinicians, not only in the AHP group but across the professions, when we see that someone is acting really professionally and really exceptionally, I think we should comment on it. But perhaps more so comment on it when things aren't quite as they should be. I think the last message I would give to you is that the big thing that Francis comments on is the need for strong clinical leadership. And I have said for a long time that the difference between leadership and management is that managers do things right, but leaders have to do the right thing. And that takes courage, it takes commitment, and it takes a real compassion to be able to do the right thing when it's very, very difficult, and pressure perhaps is to keep quiet, to keep your head down and carry on. But actually what Francis highlights is if you do that, things can go very, very badly wrong and have tragic consequences.
The new health and care system brings opportunities for all professionals delivering care. What do you feel are the main opportunities for AHPs going forward?
I think the biggest opportunity for allied health professionals at the moment, and will be for quite some time, is actually the fact that we're running out of money. I don't mean that in the sense of AHPs and AHP services, but the fact that we have increasing demand and very limited resources. We still have to improve on the quality of our services, as the Francis report illustrates. We absolutely have to do something completely different as a system. We cannot try and create a smaller version of what we've got now. We have to do something completely transformational. And I think the fact that we have the third largest clinical workforce, invisible mostly, misunderstood, and certainly not used to its full potential, I think means that there's a real opportunity for allied health professions to step in and start delivering different services in completely different ways. If the 12 professions really do want to do that, and I think it does require clinicians to step up, to take responsibility, to be very clear about the offer that we have to make. And I think that offer can be in so many different areas when you look at the 12 diverse professions. So at the moment, for me, the single biggest opportunity is around rehabilitation. We're beginning to see much more evidence come through about how rehab saves money, delivers on the outcomes framework, enables people to live more independent lives, back to work, become taxpayers, get them off benefits where appropriate. So rehab is absolutely the area that AHPs are trained in, and it's not something that we have to learn afresh. This is what AHPs do day in, day out. It's our bread and butter. So I think rehab is a real opportunity. That links very much for me with the urgent and emergency care situation, which is all over the news at the moment. And I think it's interesting that everybody focuses so much on A&E, when in fact what we really need to look at is both the throughput when someone has to go to hospital, and clearly rehab has a role there in terms of enabling safe and optimal discharges as quick as possible, but also look at the role of paramedics, for example, and how much greater role they could take in keeping people out of hospital, actually treating people in their own homes and providing an urgent primary care service. Again, we've got lots of examples of AHPs working in A&E to prevent admission, and I think that if you tie together the rehab agenda, the urgent and community care agenda, I think you've got some real opportunities for AHPs. And the last real opportunity, particularly current at the moment, is around the integration agenda. The integration between health and social care is imperative, also in relation to the whole urgent and emergency care agenda as well, because so many people come into A&E that actually it's not a health problem, it's a social care problem. And Lord Darcy described AHPs as the integrators of care, and I think very much so. Many of our professions work at that interface between health and social care. So I think that I would like to see AHPs really leading that integration agenda too.
Thanks, Karen. The big conversation has encouraged many AHPs to have open and honest conversations about issues relating to professionalism. Can you share with us your thoughts or experiences on how this is helping to improve patient care?
The big conversation was never designed to be something where we sent out a top-down instruction, we had KPIs to measure the success, we had a full evaluation of it. Because what we wanted to do was almost model the very nature of the big conversation, which was to enable AHPs, but clinicians more widely, to talk to each other about professionalism, professional behaviour, unprofessional behaviour, in a way that was safe, in a way that didn't necessarily lead anywhere, but created a culture of openness about the issue of professionalism. So we don't have an evaluation. I can't tell you if it is improving patient care. But what we do know from the evidence and the research from health, but also more broadly from other sectors and international evidence, is that peer review and peer discussion and peer challenge are the greatest indicators, or will have the greatest influence over self-awareness and a change in behaviour. And so I have absolutely every faith that the big conversation works, but only if the big conversation is a big conversation. Perhaps this conference will be a real injection of enthusiasm for kicking the conversation off again in the North West. But I was getting emails and seeing and witnessing Twitter conversations where people were being very open and honest about the situations they were finding themselves in, being able to talk to each other about scenarios that they'd seen, that they felt were unprofessional, talking about what was stopping them saying anything. Not reporting people, not disciplining people, but actually commenting in the same way that you would feel quite happy, I would hope, to comment on somebody who perhaps wasn't delivering an intervention correctly, actually commenting on people's professional behaviour. One of the most powerful things that I did, which I hadn't realised at the time, was to stand up and say how and when I've been unprofessional. And I think we're all human. And I would defy any one of you to say that you have not been unprofessional in your clinical life. And I think it is powerful to do that as clinical leaders, because it just brings us back to our basic humanity. Professionalism is very much about judgment, about context, and rarely is there a black and white answer. But I'm absolutely certain that when you read the Francis report, you look at the 290 recommendations, I feel almost the last thing we should do is go through each one, respond and measure. Somehow we're in grave danger of losing the very essence of what Francis says by doing that. And that is about the culture of the organisation. And I feel something as some people describe as a bit fluffy, like the big conversation, may just have a much bigger impact than people could ever expect.
Thanks very much for that, Karen. And finally today, what one thing would you like to encourage all AHPs to do?
I'd like AHPs to stand up and be counted and be proud. I feel that we really need to talk about what we do, take responsibility for some of the big areas of care like rehabilitation, and say this is ours, this is what we do, and we do it really, really well. And I don't think we should be backward in coming forward about that. I think we're all too modest. I think I've seen it in myself about the big conversation, and how I almost immediately go into it, oh, it's only a big conversation and it's only a chat between professionals. Actually, it's a pretty unique thing that we've done, and we haven't instructed anyone to do it, but AHPs have taken it and run with it. I think all too often we are too modest about what we could do and what we could deliver, and I sometimes think that we're modest because we're afraid we'll be called to account and we won't be able to prove it and we won't be able to demonstrate it. Well, I think now's the time to be very, very confident about what we can do. And my one big take-home message really is go out and shout about what you do and what you can offer in times where money is tight, and be proud of it and don't hold back from telling people how brilliant we are.